Here's a typical case of what we call Prepless veneers. Now, the chief complaint of the patient was simply, my teeth are short and I want them to show more. And this is one of the main indications that gives us that the patient is grinding and clenching their teeth, where they have reduced in their size and their length. Now, in those kind of cases, we can go for a Prepless veneer because technically we need to restore back what we have lost during the years. And this is done through increasing the volume of the veneers. Now, in this typical case over here, we can see that the patient has some chipping in her front teeth. We can see some old defective filling in this area. And most importantly, we can see how the teeth, they are going more inside in the right and left. And this shows let's say a black corridors in the right and the left side. Jumping to the intraoral, and this is where we can see very clearly that the patient has lost her vertical dimension, what we call the occlusal vertical dimension, where the distance between the upper tooth and the lower tooth is very minimal. Now, in those kind of cases, specifically, we need to restore back the bite and we need to raise the bite so we can gain more space in the front area. Now, we start first of all by taking the pictures and doing what we call the digital smile design. And we design the smile digitally in order to send all of this information to the lab technician and to fabricate the temporaries. Now, these will be the future position of the teeth. And you can see here how we need to increase the volume of the teeth and to gain more tooth structure. And increasing the volume means that we need more thickness of veneer. So we don't need to touch the teeth and prep them. And this is where Prepless veneers comes. After designing the smile, we send all of this information to the lab technician in order to start with the wax up or the temporaries. In this stage, it gives us an idea of whether we need to touch the teeth or not. And after evaluating it with my lab technician, we found out that we can go up to 0.5 millimeter of space for the upper and the lower dentition. Now, after designing the smile, we transfer all of the recorded digital designing to the patient's mouth through what we call a mock-up temporaries. And this is how the patient looks like. And of course, this is the temporaries where we test the phonetics, we test the bite, and most importantly, we test the thickness that we have placed on top of the teeth. We send the patient with those temporaries for 2 weeks to test the new bite and to test the new looks. And afterwards, once we approve on that, then and then only we jump to the final stage. And we can see here how we gave more tooth structure, we gave more volume to the teeth in this area, and how we increased what we call the buccal corridors on the right and the left side, how we close them. After approving the shape and after approving the size of the teeth, and then we jump to the final step, which is cementing or inserting the porcelain veneers. In this case, we did full feldspathic veneers. These are the feldspathic veneers for the upper teeth, beautifully done. We went for a bleach color in this case. And this is the final look, and this is how it looks. And we can see very clearly how we have increased the right and the left side. We have gained more volume for the front teeth. You can see over here, comparison to the bottom picture. And this here, as well as the intraoral picture, we can see as well very clearly how the bite has been raised if we compare it from this line to this line and from this line to this line, by adding more porcelain material on the top, on the back, so we can gain more space in the front and gives us the freedom of adding more volume and doing a Prepless veneer. So technically a Prepless veneer is a case selection. If the teeth are small, if we need to gain more volume, if there's a collapsed bite, in most of the cases we can go for Prepless veneers.